Hi there, Anna Staley Weiser talking to you today about lower back pain. This is a very common condition. The most common thing that I see in this clinic is low back pain, chronic, new onset, pain that radiates down into the leg. These are all very common things. And there's many reasons why you could experience lower back pain. There's also many different philosophies on treatment out there. So what I'd like to do today is show you some simple solutions that you can try at home to help yourself with your lower back pain. Really, when we talk about low back pain, it's trying to get people into one of two categories. Either people that have pain mostly with sitting and it feels better with standing and walking. And then there's those people that feel better with sitting and feel worse with standing and walking. So if you can figure out which category your back pain fits into, then that can help to guide what the best treatments for home would be. So, if you think you're one of these people that has more back pain with sitting and generally feels better with standing and walking, then what you're going to want to start doing is trying some extension-based exercises. So even though it may be painful at first, what you want to do is you want to test yourself. Try bending backwards. Even if it pinches a little bit here, do it 10 times. And after you get to about 10 repetitions of lumbar extension, ask yourself, is my pain any better? Maybe it's no different here, but it might be better and reduced down in the leg. If you don't feel any change yet, try 10 more repetitions. Usually what will happen is you will notice some improvement of either your back pain or your leg pain. And this will tell you definitely that you need to be doing extension-based exercises for your lower back. So extension-based exercises can be as simple as just bending backwards like this. Also, you can lie down on the table or on your bed at home, and simply just lying on your stomach is a position of extension. And if you can do that okay, then you can try to progress yourself into further extension. So prone press up, that will extend your back. Do that one several times. Once you feel pretty comfortable with that, maybe a few days have gone by, your pain's not so bad, then you can start working into active extension. So using your back muscles to put you in a position of spine extension. So why does spine extension work good for people that have back pain with sitting and bending forward? Well, pain that comes on more with sitting or bending forward is thought to be more related to discogenic low back pain, or pain arising from something wrong with the padding in between the vertebrae or the lumbar discs. So you can see how the disc is on the front side of the spine. If this is the back and this is the front, the disc is more towards the front. So if you extend your spine, you can see how there's going to be a little bit less pressure on the lumbar discs. And that's why people with discogenic low back pain tend to feel better with standing and worse with sitting or bending. Now, if you think you're one of these people that has more pain with standing and walking and they feel better when they sit down, then you might be a person that would benefit more from flexion-based exercises. So again, what you can do is you can try bending forward. Maybe try it 10 times. And if forward bending, 10 to 20 repetitions makes your back pain feel better, then most likely you need some flexion-based exercises, at least in the beginning until your back pain is under control. So flexion-based exercises would be starting out lying down, maybe pulling your knees up to your chest, something like this. This is a flexion-based exercise. Or sometimes one knee to the chest and then the opposite knee. Those can be comfortable too. So how come some people need flexion exercises while other people need extension exercises? Well, if you have more pain with standing, but you feel better with flexion or bending forward, then most likely your pain is thought to be more coming from the facet joints. So these are the joints in your spine that articulate with each other when you move. So when you're standing, you can see how the facet joints approximate each other and come closer together and close down. And so if there's something wrong here, like arthritis, then this can be very painful. And so that is why sitting and bending forward can alleviate that pain. Some other exercises that would be good for people that have pain with standing and walking is exercises to stretch out the hips. So if you have tight hips and they're pulling you forward because you're so tight, then your low back is going to arch like this when you try to stand up straight, and that's going to cause pain. So if we stretch out here, that's going to alleviate tension in the lower back. So stretching out the hip flexors. What would a hip flexor stretch look like? The easiest and my most favorite way to do a hip flexor stretch is to get down on one knee and push the hip forward until you feel it stretching right here. Hold it for about 30 seconds and then switch and do the other side. Another exercise that is very helpful for all types of lower back pain is called trunk rotations. So lying down and twisting your lower half of your body from side to side. So knees would be bent and you would just start twisting back and forth, nice and slow. And what that exercise does is it gets a little bit of therapeutic movement in the joints of the spine and in through the discs, and can work to hydrate the discs and get everything feeling a little bit better and less stiff and painful. So one common problem that I see with all types of lower back pain, especially people with discogenic lower back pain, is that they're not using proper positioning when they sit. So sitting is very important. Sitting puts a lot of pressure on the ligaments in the lower back, a lot of strain, and also pressure on the discs, especially if you're sitting with a rounded posture. Slouching posture can, over time, cause a lot of stress on the lower back. So what you really need to do is grab a couple of pillows, whatever it takes, and get those behind your back. I like 2 pillows because I have discogenic low back pain. So I need a lot of extension in my lower back. So I put a lot of support back there. The pillow should lift up your rib cage and allow you to relax in a more neutral position for your lower back. Ultimately, it should be comfortable for you, but it's needed for everybody. So although it's tempting when you're sitting and watching TV at night, it's tempting to kick your legs up like this while you're watching TV. But if you have any kind of sciatic problem or pain down the leg, what you want to do is avoid kicking up your legs when you're sitting, because that just puts more tension and can make your low back and sciatic pain worse. Positioning with sleeping is also a very important thing when you have lower back pain. So most people like to sleep on their side. So what's recommended is when you lie on your side, you don't want to have the top leg forward like this because that can twist your lower back and cause pain. What you want to do is put the pillow right in between your knees so that your lower back is aligned properly and there's no extra tension through your hips. If you like sleeping on your back, a lot of times it can be painful though if you just lay perfectly flat. So what you can do is add 1 or 2 pillows under the knees, and that usually takes some of the tension off of the lower back. I hope this short video has been helpful for you in figuring out a way to get your low back pain under control. If you have questions, feel free to reach out to me. Text me, email me. I'm always happy to talk to you and answer any questions that you might have. Thank you.